Blood cells are uniform size and shape, thus having a mean corpuscle volume, or MCV, of approximately 78 to 98 FLs. Red blood cells that are larger than 98 are termed macrocytic. Macrocytic anemias generally occur when the nuclei of the maturing red blood cell appear larger relative to the amount of hemoglobin in its cytoplasm. These are usually caused by a problem with DNA synthesis. This could be induced by a vitamin deficiency, like B12 or folic acid, or drugs that interfere with DNA synthesis, such as sulfamides. This session will focus on a B12 deficiency, most notably Pernicious anemia. So, vitamin B12 deficiencies. The etiology of this, so B12 firstly, is commonly found in things like meat, poultry, dairy, and eggs. These foodstuffs are then taken to the stomach where the hydrochloric acid extracts the B12, and then the intrinsic factor, both of which are released from parietal cells, are taken down to the distal ileum where it's absorbed. Therefore, a B12 deficiency can arise either from a decrease in stores of B12 or a malabsorption of B12 from a stomach problem, parietal cell autoimmune issue, which is pernicious anemia, or a distal ileum issue such as Crohn's disease, or a reduction in B12 intake, most commonly seen with vegans who have no meat, no eggs, and no dairy. So, the pathophysiology, now focusing on pernicious anemia. Well, it all starts in the stomach. It's an autoimmune disease, so the immune system attacks specifically the parietal cells in the stomach. So therefore, the stomach doesn't release sufficient amounts of hydrochloric acid and intrinsic factor, which is important to extract the B12 from the foods and transport it down to the intestines. So there's no intrinsic factor taken to the distal ileum by the intrinsic factor, therefore the amount that's been absorbed is reduced. As a result, there is some stores in the liver which can last up to a year or plus, but slowly this diminishes, and therefore the amount of B12 in the whole body is reduced. As a result, we have DNA synthesis issues, and therefore the production of red blood cells are impaired. As a result, we have fewer red blood cells, however they are much bigger, so we have an increased MCV, and we have an overall reduction in hemoglobin, a reduction in red blood cells, and a larger MCV. The clinical manifestations associated with pernicious anemia would run with the standard anemia type symptoms. However, in addition to that, we have tachycardia and possible left-sided heart failure. We have glossitis, which is a swollen, smooth, shiny tongue. And then because B12 is also important for myelination of nerves, we could have neurological issues like paresthesia or numbness. So finally, what's the treatment of pernicious anemia or B12 deficiency anemia? Well, obviously it is a IM injection to bypass the GIT of B12 in conjunction with folic acid.